This is Eyewitness News Health Beat.
And on the Health Beat this noon, the medical challenges that your students may face as they head to campus. Dr. Steve Samuels with Franciscan Health joins us this Tuesday. Thank you for being here.
Thank you for having me.
So kids go up to campus, they're in a different environment, they have different exposures, and what might pop up that they haven't had before?
They're exposed to new allergens, new dust, new molds can set their allergies off, and allergies, if you're going through it, can make it difficult to study.
And what are some of the things that if you're in an environment and you have these triggers that maybe are good solutions?
Yeah, we recommend the simple medicines, a lot of them over the counter. Claritin and Allegra are good antihistamines. They're now nasal steroids over the counter, nasal quart. We recommend to avoid using Zyrtec and Benadryl as your antihistamine because they can cause sedation, making it harder to study, may decrease your test performance.
And the mattress is also a concern.
Absolutely. All that body dander, that mattress has maybe been in that same dorm room for years, bed bugs and things like that. Getting a hypoallergenic mattress cover that you can wrap the mattress in is a good idea.
And let's talk about some health maintenance, some preventative steps that kids can take.
One of the things when we see flu outbreaks, they run through the colleges very rampantly, and most of the universities don't require the flu shot, but we strongly recommend it. Now they do require the meningitis shot, and so your kids will have that before they go to school typically. And
you're saying take a multivitamin, and also why this recording your weight?
Well, just watching your weight. The freshman 5 is well known. It sometimes becomes the freshman 10, the freshman 15. So recording your weight weekly, watching it, you're changing your eating habits when you go to school. You may have some nervous eating. It's new foods to you sometimes, so the weight gain can occur quickly. If it starts to, it's easier to get it under control if you attack it quickly.
And I understand another common diagnosis on campus is that of mononucleosis.
Mono is very, very common, especially in the fall months. We'll see it. The fatigue, somebody comes in very fatigued, they may have a sore throat, their lymph nodes are a little bit swollen, maybe some belly pain from the spleen being enlarged, and so that needs to be addressed. If they get mono, you want to make sure you seek medical attention. Differentiate it from the strep throat, because if you give antibiotics for mono, sometimes you can actually make the person worse. And occasionally, if they really have a bad case, steroids can be an option for that to get that person back in the swing quickly.
All right, so here's some treatment options for mono. Now let's move on to Adderall, because this might be something that kids have access to on campus and to use caution.
Adderall and the other stimulants like Ritalin are very common in ADHD kids. There's a lot of kids going to college now on these medications, but it's also being abused at the colleges as a benefit to maybe taking tests. You'll do better, or you can study later and longer with it. It's not a good option. You should not use it. Simple caffeine is a way to stimulate your, keep the brain a little awake a little bit longer. Adderall can be very, very addictive, and so you want to avoid that. Don't take it unless it's prescribed by a doctor.
All right, thank you very much, Dr. Steve Samuels. And I want you to know that we are not skipping alcohol. Of course, binge drinking on campus is something that's very important, and that is a topic that we'll address the next time that Dr. Samuels is here. Thanks for coming for Ask the Doctor segment today.